Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about something way off topic, but not really off topic. We're going to talk about the two things that I think you need to have when you practice complex chronic illness as a doctor. The first is you need to trust your gut. When your patient tells you it's red, but you see it as blue, it's likely blue, because patients are so ill that they can't see themselves. And a lot of them live alone, and so they have no mirror. They have nobody to bounce things off of. And so, when your patient says, no, I don't have Babesia. No, I don't have Babesia. But you ask them a bunch of questions and they have really bad night sweats and they have air hunger and they have a pressure headache that feels like a band around their brain, you know right away they have Babesia. And that's what I'm talking about, trusting your gut. It's really, really important as a clinician to be able to access your intuition and use it wisely. And the other skill that I think is super important is listening, and I mean carefully listening to your patients. And I think that that's what traditional doctors don't do, because the system forces them to rush. They need to see patients in 7 minutes. Well, that is just absolutely ridiculous, especially post-COVID, when people have COVID vaccine injuries. They have long COVID. They have COVID. They have reactivated Epstein-Barr. They have tick-borne illness, mold, and COVID injuries. I mean, you can't do it in 7 minutes. You can barely even do it in an hour. It's hard. It's very difficult. And I think I'm a seasoned practitioner. I've been practicing for 26 years. I'm not new. So, I really think that the two most important things is that clinicians need to trust their gut. They need to access their intuition. And if you don't have it, try and develop it. Take a course, do something, because intuition is never wrong. Your guess might be wrong because it's not based on intuition, but your intuition, like instinct, is never wrong, because it's evolutionarily really, really old, and it's what beings use, not just human beings, but all living beings use to survive in harsh environments. So it's super important. And then the other thing is you have to accurately listen to your patient. They will tell you what's wrong. They might not be able to connect the dots. Some can, but they might not be able to, but you can. And you do that by carefully listening to them. It's just critical. And you need to always be very, very present with your patients. It's super important. So trusting your gut and listening to patients, you will be 100 times more effective at your job if you do those two things. So I hope this information has helped, and I hope you have a wonderful day. Take care.